Welcome to Live to Thrive podcast. This show is for every person of color who has ever been underestimated, overlooked, or stuck in survival mode. Your story isn't over. Each week, you'll hear from folks who have faced the odds and kept going, sharing real talk, tools, and the truth that helped them push through. Let's get into it. Welcome, Live to Thrivers. Welcome to another week's podcast of Live to Thrive podcast. I'm your host, Lizzie Kutsia, and today we are joined by Kwame Terra, and I'm so excited that you're here. Thanks for being on Live to Thrive podcast.
Yeah, great to be here, Lizzie. Looking forward to the conversation.
Yeah, so Kwame, what I wanted to just start off with is just from the beginning, where were you born and raised?
So I was born in New Orleans, Louisiana, and I grew up about 5 hours away in Houston, Texas.
And so you are currently currently in Louisiana right now, right?
That's correct.
Awesome. And so tell me, how did you get into your line of work? Can you tell me a little bit about that and what you do?
Yep. So I'm currently the CEO of bEHR. We're a startup company based at Xavier University of Louisiana here in New Orleans that's committed to maximizing health in the Black community. So our first goal as a company is to communicate clearly to the Black community our current health status. And we do that through a health score. So health score is kind of like a credit score, but for your health, you'll receive a score between 0 and 1,000. That'll be based on your lifestyle, your medical health, family medical history, so on and so forth. When you first download our app, you'll complete an initial assessment, ask you about 12 questions from each category of health that we have, and then you'll get your initial score. And the cool thing about it is that your score will change as you change. So if you go on a run or a walk one day, your score will go up a few points. If you get 2 or 3 hours of sleep one night, your score goes down. And then based on those changes, you'll receive messaging from our AI coach, as well as have the opportunity to connect with healthcare providers and resources on bEHR Connect. Like I said, our first goal is to communicate clearly to the Black community our current health status, because frankly, most of us don't know how bad we're doing. We know we should be doing better. We know we should be moving more and eating better, but I don't think many of us know that we could have a heart attack at age 45 if we don't get it together. And I just want to help people become aware of that so that we can start to make changes to, be able to be here for our families long term.
I love that. And how did you get into this?
It's a pretty long story how I got into it. I've been into health and wellness all of my life. I former college athlete, ran cross country and track. Come from a family of runners, and our dad always made sure that we were eating the right things so that we could be fueled to compete at the highest level that we could. And that was kind of the seed of it. And then I went to Xavier University for undergrad and graduate school, and Xavier is well known for creating Black doc. And so it was a very, very science and medicine focused undergraduate education. I didn't end up doing a medical degree. I didn't end up pursuing a medical degree. I got into public health, mainly because I wanted to be able to have scaled impact. As a physician, you can only treat so many patients, and the way the system's set up here, the majority of that time will be spent prescribing medications. The majority of the diseases that we deal with in this country, and especially in the Black community, are predictable, preventable, and reversible. Hypertension, type 2 diabetes, and many cancers are, again, things that we don't necessarily have to live with. And instead of spending the majority of our healthcare dollars on those conditions, I would like to invest in preventing them in the first place, or reversing them, helping people find ways to live with these conditions without having to take so much medication. And so when the COVID-19 pandemic hit and the virus was preying on the most dispossessed among us, those with comorbidities, hypertension, and so on and so forth. That was a tipping point for me. I just wanted to do something so that next pandemic or next challenge that we face in the Black community, we're in better health to have a better outcome. And again, my first thought was, I don't think we know how bad we're doing. So I want to communicate to people.
That's so awesome that you're helping the Black community. And what made you actually just focus on the Black community? Was it just specifically because of these diseases hitting the Black community, or was it just something that you decided to do?
Yeah, this is really about solving a problem. My understanding, based on my education and training, is that our current system, though equipped, was never designed to solve this particular health problem in the country, the health problem that exists in the Black community, these disparities. And so I'm just trying to solve a problem. It's not necessarily racially motivated or politically motivated in any way. It
Yeah.
is just my understanding that when the policies, the practices, the beliefs, and the structures that cause these disparities, right, that
Mm,
created these problems that we see, these were very targeted, policies, practices, beliefs, and structures, right? They were overtly racist,
yeah. Yeah.
influences. And in my opinion, the solutions, again, based on my education and training, the solutions should be equally targeted,
Mm,
really creative in
yeah.
finding ways to create solutions to address these particular problems. And so it's just the best way to solve the problem.
Yeah, it's good to know that there is a tool out there that people can download, use to better themselves. And so, when you thought this idea up, what made you think of an app?
So there are tons of like health and wellness workshops and seminars and social media influencers all over the country. And these things get people excited about their health. They get them educated for a moment and then they're really motivated to change their diet, exercise more. Then like 2 or 3 weeks later, they fall back into their old habits, right? They're back in their old environments, and as life becomes stressful and you just don't have time to make sure that you're prioritizing your health and wellness, again, you just naturally fall back into what the current environments are designed to create, which is disease promoting lifestyle, right?
Mm,
There's fast food on every corner. There's just convenience everywhere, so you're not going to move as much as that you would if that convenience wasn't there. And so people are naturally going to fall off, and workshop or seminar, again, we'll get somebody excited for 2 weeks, but then where's the follow-up after that? So I know I wanted to build something more than just another experience. I wanted to create a system whereby we can stay engaged with folks over a long period of time, where we can determine which interventions or workshops or seminars were the most effective, right? So 1,000 people went to this workshop in Atlanta, and all of them stayed on their health journey consistent and committed for 60 days. Okay. Then people started to fall off. I want to be able to see these things and be able to nudge people and re-engage them with their health journey, for whatever reason that they fell off. And then we'll be able to see these trends and compare them, by different cities, right? So we'll see the average health score in the city of New Orleans and be able to compare it to the average health score in the city of Atlanta. And maybe Atlanta's doing much better, and then we can start asking why, and then be able
yeah.
to apply some of those learnings to the New Orleans area so we can improve the community. It's really about just being able to have as many insights as possible to again effectively solve the problem. So that's
I
why I
love
really
that.
build an app, and it's also a good way for us to reach millions of people quickly.
Exactly. Exactly. And do you have a social media platform that people can follow you on and learn more, or is it just strictly through the app?
Yeah, we're certainly on social media, primarily on Instagram at Bear
Okay.
Health. That's at BEHR Health. We also are picking up our TikTok right now. Just hired a social media influencer. She's asking me to do all kinds of interesting things, but I'm open. I'm willing to
Yeah.
try it out and see how it goes. I'm not against TikTok or anything. It's just not a platform that we're on just yet. But yeah, you can follow us, and you can follow me at Kwame Terra, KWAME TERRA, on pretty much all platforms.
I want to go a little bit into learning about you. Like, as a CEO of this company, what does your day to day look like? How does a typical day start? Do you have a routine?
Yeah, I wish I could share my screen with you or the audience right now that shows my to-do list, but it's basically just staring at a giant to-do list all day, every day, until it gets smaller and smaller. I do my best to accomplish as much as possible, but I've understood, I started to understand early on in this that I have to I have to get comfortable with incompletion.
Yeah.
And then my job is to do as much as I possibly can within a reasonable amount of time, affecting my overall health, right?
Mm,
I have a few priorities in my business, my health, and my family.
yeah.
And I don't really want to sacrifice any of those for either one. But that's also part of why I don't have many other priorities outside of that, because those things can compete and then they can become distractions, so on and so forth. But as far as my day to day goes, I wake up in the morning, typically around 6 a.m. I will, shortly after that, first thing that I do is drink some water, drink some spring water.
That's
It's the first thing I
yeah.
do. Depending on the day, I may meditate before I run. or meditate after. It's nice meditating after because, endorphins are still flowing and everything like that. And then I make it to the office by 8 or 8:30. And I kind of get to work. I meet up with my students, my student interns that I'm with this summer around 9, and just check in on what their objectives are for the week based on the goals that I'd given them in the evenings. So I pretty much spend the next several hours in my office.
Yeah.
Unless we have an event that we're doing a tabling activation at. And then in the evenings, I spend my evenings typically at run club meetups, depends on the day.
I love the run club. I think it's like such a 2025 situation that like young adults go and like they are keep it like as a social thing to do with run club, which is so awesome to incorporate your social life into your health and wellness as well.
Yeah, it's perfect. I mean, it's a perfect intervention. And I know that most people aren't looking at it like that, but obviously as a public health advocate and practitioner, I see this as one of the greatest public health interventions ever. It's getting people who typically aren't moving to move, and it's helping people find others to connect with, which is a pillar of health. But that's the first step in our blueprint to health is community and purpose. People aren't going to care about any of the tips and tricks to improve your health if they don't feel like their life has meaning and they don't feel like they have people in their corner. And so these run clubs are really hitting that on the nail, and many of them might not even really realize it, the impact that they're having on people's health with that. I'm confident that run clubs are saving the healthcare system millions of dollars a year with the work that they're doing. And part of what we want to do as it relates to collaborating with run clubs is be able to provide them that data that they can use to go get some of that money that they're helping the healthcare system save.
Love that. That makes so much sense to me. And if you had advice for someone who does want to start their own business, or like you said earlier on in the podcast, solve a problem, what advice would you give them and how would you tell them to start?
Yeah, definitely just talking to people with problems. And it depends on like if you already know what you're passionate about or not. If you don't already know what you're passionate about, just go talk to people with problems. And we all have problems. And good startups, good businesses, they just solve problems for people in a convenient way. And I actually made a post today on Instagram about how businesses are successful because they talk to more people with a specific problem and test more solutions against that problem than other people or other businesses do. And over time, if you do that enough and you actually apply what you learn from the conversations, you will develop the best solution or a better solution than that is currently on the market, and then you'll have a business. If you do know what you're passionate about, it's really the same thing, except you just focus on what you're passionate about. So I'm passionate about health and wellness. I wanted to solve this specific problem, so I talk to Black people with health problems. And then I go and incorporate what I learned from them, and we send different push notifications. We host different events, and then we continue to iterate until we have a solid solution that people engage with on a regular basis without us necessarily having to nudge them to engage with us. So yeah, any advice, I would just say, one, know the problem that you're trying to solve and actually try to solve a problem. It's a much better business to build than like a cool idea that you have in your head that you think would be cool, like needs to be solving a problem. And that could be a problem that you're solving for yourself too, because if you have a problem, it's likely that other people have a problem, have that well. Understand that you're not just competing with people in your industry, you're competing with the world for the attention of people at all times, especially early on as an under-resourced owner or founder. And just kind of accept that. One thing that's really important, at least for my mentality as it relates to businesses. So what do I mean? So if it takes me talking to 10 people to get a user and I want to get 100 users, well, I need to talk to 1,000 people. And so my goal for the week is to talk to 1,000 people, not to get 100 users. And you have to really connect your activity to what it takes at minimum to get the certain outcome that you want. Because a lot of us will try to talk to somebody to engage with our product or service, and when the first 5 people don't download your app or buy your product, people get discouraged or even give up. And so I was telling people earlier, even if only 1% or 0.1% of the Black community engages with our platform, we're a multi-million-dollar company. The majority of people won't even know who we are, but we're still a complete success from a business perspective. Maybe we don't achieve our ultimate vision of making this endemic to the Black community, but we at least have a successful business. It kind of takes the pressure off you to deliver because you're able to focus on the activity.
I love what you said. For successful businesses to talk to people, because I think, you know, in the environment of starting your own business, it's very easy to get discouraged when you're building something. And I love the point that you made of like talking to people and finding out what the problem is to help them solve it will help give you motivation to, work on that project. So that goes into my next question. You've gone through some tough decisions. How did you deal with that mentally? How did you deal getting up in the morning to go to work and telling yourself every day that this is what I want to do, even when you felt, I don't want to do this anymore? What was your motivation
Hmm.
behind it? And I know that you've spoken a lot about your motivation about helping solving a problem, but I just want to turn it to you and see how you handled it mentally and how you pushed through roadblocks in this process.
Yeah, I haven't been asked that question in a while. And so, as I'm reflecting as you're asking, I did want to comment first on the idea of talking to people again, and how a lot of people often they'll like sit with the idea in their head and bounce the idea off of their own mind. But you get much better feedback when you bounce your ideas off of reality because it's just more accurate information. And then you can use again that information to develop and refine the idea. But just another point of encouragement to get people to share their ideas and talk to people about the problems that they have, because you just get much better information. But yeah, as far as when it gets hard, we've been pretty fortunate, I would say, in this journey so far. In January of 2023, I decided to go full time. Now I wasn't making any money actually. We didn't even have a product or service. I had just got fired from a job in December, or two jobs actually in December. And so I figured that'd be a good time to, go all in, see what I can do. And early on the first 3 months, I had a little bit of money from a paid suspension from one of the jobs. So for the first 3 months, I sat in this office all day and I applied to as many startup accelerator and incubator programs as I possibly could. I think I finished the year having applied to like 65, 70, 80 startup accelerator and incubator programs. And for those who don't know, they're basically like boot camps for startups, help you. They typically give you some money. They get you access to networks that can help you, avoid a lot of the mistakes that early stage founders make on their journeys. And so I applied to about 80 of those, and I think we got like 10 or more that year throughout the country. We raised a little over $80,000 as a company, and that was my first year in this. And so, for it to be our first year and to raise 80 grand, that's pretty encouraging, right? That doesn't mean that year there weren't, significant ebbs and flows in capital. There was a whole month where we nearly had no money. And those days they're so heavy. Those days are so heavy, and it's hard because now you kind of have a team around you. Once you have a team around you, you don't have cash. It's just different because they're looking to you to maintain, the confidence of the entire organization. And you're not necessarily sharing with them the fact that things are so challenging. And so, but you have to get up every day and figure out how you're going to execute on the goals of the day, despite the bank account. I would say that's really been our only challenge so far along the journey. The following year, we raised close to 300,000. So last year, 2024, but we spent a good amount of that kind of launching our tech that'll be officially coming out this fall, and hit another financial rough patch because we lost a grant that we were expecting at the beginning of this year. And what I will say is that each time it happens, it doesn't weigh as much because you've already gotten through it. And so long as you continue to take action, that's really the hardest part in the midst of especially the financial challenges, to continue to take action on the fundamentals of what are important for your business right now. That's fundraising, that's user growth, that's um and that's activations. It is hard, but it certainly gets easier each time. This is probably the third time that we've experienced this in 2.5 years. But I can just tell like every aspect of my body that typically gets super stressed by this, it's just not as stressed this time. Hair's not falling out as much, right? Not losing as much. I mean, it's just, because your body will tell you that you're stressed, even if you might not think it's affecting you like mentally. Your body it'll show up in your body because your body's paying attention to everything. And so, yeah, it's how do I get through it is honestly, I think I dream bigger. I dream bigger in these moments. Some of the best ideas I've come up with have been in these moments. And so that's another thing I also now don't shy away from them because you can start to cook a little bit when your back is against the wall. And it's not so much, I don't even think it's like back against the wall because it's not I need to find this money so that I can continue it. It's when you have nothing to lose. Right, when you're at a low point and you have nothing to lose, I feel like we naturally tend to dream even bigger, or at least that's what happens with me. And at our lowest point in this current financial downturn, we came up with our campaign for the official launch of our app this fall, which honestly the best idea I've come up with all since we've been doing this. And so I know it might sound cliche to say it's a part of the journey, you take it in stride and all that stuff, but yeah, keep the vision clear, keep taking action. Like you have to keep taking action. Again, you're not entirely in control of the outcome, so there are going to be periods where things don't work out, but eventually, specifically the financial aspect, the financial downturns become less frequent. They get shorter, and eventually you will reach a level where you won't really be in a position, you won't reach a complete downfall, right? You'll be able to have some basic level of stability and security to where the stress and the crisis that you experience in these ebbs and flows just kind of goes away. I feel like that's our next two. I mean, I don't pray at all that we have any more financial challenges, but if we have another, I think we maybe have one or two more before we really hit that hockey stick growth as a company. And again, made it through each one so far. Haven't lost any significant relationships along the way, and that's been yeah. But like I said, we've been fortunate, but it's all matched because matched by the effort that we're putting in. We just work.
Hope that you get all the success because it's an amazing app, and I think that it's doing what you're saying, it's helping people. And I just have like one more question for you is if you could tell your younger self one piece of advice, what would you tell him?
How young?
Like, let's say 13.
13. Doing it at 13.
Teenager, figuring out life.
Sure. Yeah, I don't know. I was pretty ambitious then. I think I learned a little bit before then that part of what made me unique as an individual wasn't necessarily that I was like naturally more talented or gifted than everybody else at different things, but I just tried way harder. I was good at running starting in elementary school. I was good at math. I was good at all these things that we care about as teenagers that to help us with our popularity and whatnot. And a lot of people thought, again, I was just kind of like naturally talented at things, but I like tried really hard, and I still try really hard. So I guess I would say to him, keep trying really hard, because I think sometimes I felt like I was a try hard. Nobody likes a try hard. Nobody likes someone that is always trying to win or whatever. Yeah, and so sometimes I would kind of shrink to not make people feel, I don't know, uncomfortable in some way. And so yeah, maybe I would say just keep trying hard and try harder, because I think when you're younger, the only environment that you're aware of is kind of your immediate environment, your friends, your neighborhood, and on some level you're trying to compete just with them, right? Or trying to be better than just them. But there's a whole world out there. And so I think I would have told myself, there's a whole world out there, and just because you're competitive in this environment doesn't mean that you're the best. And so you need to continue to level up, because there's a whole nother level out there, a whole nother world out there. And yeah, you're gonna confront things that you've never confronted before. So you have to be more than you are. So just
Love that.
keep trying hard.
I love that.
You guys follow me on Instagram at Kwame Terra, Kwame. Terra. Follow us on Instagram at bEHR Health, bEHR Health, and download our app in the App Store. You can try our beta app. It's called Dacadoo. It's Dacadoo. It's our technology partner. It's going to ask you for an access code. You could put Live to Thrive, all caps, as the access code, and complete your initial health score assessment and be a part of the official launch of bEHR Health this fall.
I love that. And I'll have everything in the show notes so it will be easy to access. But I just wanted to say thank you so much for being on Live to Thrive podcast and talking about the app, and really appreciate your time.
Yep. Thanks for having me. It's been great.
Thank you. Bye.